Dr. Debisi.
Hi, can you hear me?
Yes, I can hear you. How are you?
I'm good, thank you.
Thank you. Thank you so much for agreeing to do this. I really do appreciate you. I think is that Dr. Saka?
Good morning or good afternoon.
Good afternoon. We can't see you though. So I think you need to turn your camera around.
Okay.
Hi.
Guys, show them some love. Welcome, Debisi. And Dr. Saka is still trying to come on. Kolia, I'll bring you on shortly. So just give us a few minutes. Yeah, that's better. Yay, thank you so much. How are you both doing?
Yeah,
Very well,
good.
thank you.
Okay.
After last night.
After last night.
But actually, I'm rather inspired by you because if you've been up this morning by 6, following the whole week's events, you're in Basingstoke already. It's not like you're in London. You're in Basingstoke already. So yes, I need to take a bit of inspiration from you.
I know, but don't forget, you guys have had a busy week. So, but anyway, thank you. So let's show them some love, hugs. And Dr. Saka, this is his first time. So please show him some love. Let him feel comfortable. Let him know that we appreciate him. And the same for Debisi. This is her first time on Hangout Cafe, even though she's a founding member of Hangout Cafe. I remember my husband was asking that, oh, does Debisi know anything about Hangout Cafe? I'm like, what? She's been there since day one. Yes.
Yes.
She's a founding member. Okay. Before I bring Kolia on, Dr. Gbenga and Dr. Saka. I can tell that I'm tired. Dr. Gbenga and Dr. Saka. This is so funny. Okay, calm down. Okay, Dr. Debisi and Dr. Gbenga, can you just tell us briefly about what you do, just for our audience who don't know you? I know most of them probably know you, but those who don't know you, can we have ladies first? Debisi, can you please tell us about what you do?
Hi. Can you hear me? Can you still hear me?
Yes. Yeah.
Okay, fine. Yeah, so yes, thank you for inviting me on Hangout Cafe. I am a GP. Been a GP for over 13 years now. And I work in Southeast London. I'm also a clinical project lead for Southeast London CCG, and I am a clinical director for LTEM Primary Care Network. So yeah, GP.
Thank you very much. Are you married and you have...
Oh, yeah. Yes, I am married. I've been married for almost 20 years now, and I have 2 girls, 17 and 13.
Wow.
Yeah, and yeah, I love Hangout Cafe, love reading, love doing different things. But yeah, that's it.
Thank you. Thank you. Do you have your Hangout Cafe mug?
I do.
Yay! I don't have mine today, so you're representing us. Okay. Dr. Saka, please tell us about yourself.
Yeah, so my name is Gbenga Saka, and I'm a Christian. Been in Jesus' house since 1997, 98. I'm also a husband, and I'm a father of 2 boys. One is 18 and one is 15 going on 16, and the eldest has just gone into uni. So I'm getting adjusted to having not having one of them at home. On the other side, I'm also a medical doctor, and I'm a medical oncologist. I look after people with cancer, and my main aim is to try and give people hope, make them live on with or without their cancer, and just make sure that they have a very comfortable existence.
Wow.
As an aside, I work in the healthcare team in Jesus House. I also help with different voluntary projects. I participate particularly in voluntary projects in Nigeria and helping to establish better outcomes for cancer in general in Nigeria, through an organization called British Nigerian Oncology Group. So we're having a footstep and footprint in Nigeria, which helps to provide help and direction for people with cancer in Nigeria. Aside from that, I like traveling. I like reading. I'm very much interested in anything with science. And in terms of my main hobbies, I like cycling. And for those that know or may not know, I'm also an avid Arsenal supporter.
Oh, please, Arsenal, Liverpool, Liverpool. Okay, Arsenal. Okay. Oh, well, my son supports Arsenal, so I guess you guys.
I know. That's why I had to throw that in.
That's why. But we support Liverpool. Well, my husband does. I really don't even know anything about football, to be honest. Don't tell him that. I don't have a clue. Okay, I'll bring Kolia on shortly, but the reason why we're doing this, the reason why we have Dr. Debisi and Dr. Gbenga on today, is that this month, the month of October, is Breast Cancer Awareness Month. And we thought it would be good to talk about this thing that for a lot of people is still a stigma, but we want to raise awareness. And I love what Dr. Gbenga said, that he wants to give people hope. We want people to know that this thing does not necessarily have to be a death sentence, especially if it's detected early, I believe. Even if it's late, by the grace of God, there's still treatment available. So that's why we want to talk about it and talk about things to look out for, the treatments available, and other things. But I'm going to start with Dr. Debisi, because she's a GP, and most times when people feel that there's something wrong with their bodies, it's the GP that they'll go to first of all. So Dr. Debisi, tell us, if a lady comes and, okay, actually from your experience, what are the different ways in which people present to you when they feel that they have cancer or breast cancer?
Okay, so the commonest thing people come with is they felt a lump in their breast or in the armpit, so the axilla, because the breast tail goes all the way there. It could be that. That's usually, the commonest thing. Oh, I felt a lump. Some people come with breast pain, and as the breast consultants let us know, they're like, most cases of cancer don't have pain, but anything, breast pain, or some abnormality, or they notice something on their breast, and they just come to the doctor to be seen. I think one of the biggest things that helps with breast cancer awareness is for us as women and men to be breast self-awareness. That's what we call it now. It's and I say this so many times, people, about checking yourself and doing breast self-examination, and people say, oh, I don't know what to feel for. I don't know, I don't want to be, I mean, how will I know? I don't know, I need to see a doctor and things like that. But really, no one is asking you to diagnose yourself. What it is about knowing what is normal. So when you feel or see the abnormal, you can go to a doctor. You can go to your GP. You can say, this is what I've noticed that is different. This is what I've noticed that has happened. And that's, so the advice is at least once a month that you should check your breast and your armpits, do a self-examination. Make sure you look at yourself in the mirror, look out, so you know what is normal. So those are the things that we advise all women and men. Yes, it's rarer in men, but men do get breast cancer as well. So you want to check regularly if you notice a difference, even if it's a skin, your nipple, anything. You can go to a doctor. But yes, the commonest presentation, I think lots of women come with, is, oh, I felt a lump in the breast. Some people, it will be breast pain, but most of the time it's a lump in the breast.
And I guess you also want to talk about, because when I don't know what age it is now, that you get, I think it's over 25.
Mammogram.
Mammogram, yeah. What age? Is it from 25?
So on the NHS screening program. It's from the age of 50
Oh,
that you
really?
get mammograms, and it comes and they'll call you every 3 years. Now, if you have if there's a family history, which is quite important for you to know. So, for instance, family history, we would say, your first degree relatives, so mom, dad, siblings.
Okay.
You might be called in earlier at the age of 40. There are some people that, because of their family history, they have to have a mammogram maybe once a year and
Right.
things like that. So they look at that, and depending on, for instance, if your parent or sibling had breast cancer at the age, the type, and things like that, then you can be called earlier. But in the NHS screening program calls people from the age of 50. Sometimes they come slightly earlier, so you might get an invite at the age of 48, 49, but generally 50 and every 3 years. And it is so important to go for your screening. Please, please, please don't miss it. If you missed it, call up the number. There's a general number. You can get booked in as well. Screening is so important because it can pick up abnormalities in the breast. It can pick up early breast cancer where feeling, self-examination, and all of that cannot pick up. It will be really tiny and you might not be able to feel anything. So don't miss your screening. It's uncomfortable. Yes, people say, oh my God, I don't like it. It's painful. It's not really painful. It's just uncomfortable. Just like the cervical smear. It's not a pleasant procedure, but come on, it saves lives. So please don't miss your screening.
Thank you so much. And it's not, I guess the word is uncomfortable for the mammogram. It's not painful like that, I think.
Yeah, it's just uncomfortable because obviously some
uncomfortable.
people say they press on your breast, but some people will go in and say, oh my God, I didn't like it. But, it's about thinking about what it is doing. A screening program, every time we have a screening program, is to either detect early forms of cancer, or, if the cancer has some pre-cancerous conditions like the cervical smears and cervical cancer, you want to get it checked. So for me, it's like, listen, go for it. It is, as we said, it's uncomfortable. It isn't painful, but it is for the greater good.
Okay, thank you so much. Okay, Dr. Saka, so at what point do they get to you? Do they get referred to you?
Okay. Just to buttress what Debisi has just said about screening, mammograms can be uncomfortable, and one of the things women say to us, you don't know what it feels like. And just to
I was
stop
just going to
women,
say to you, how do you know?
but I've had one done just to stop people telling me you don't know what
You
it feels
actually
like.
had one done?
Yes.
Oh, wow. Okay.
So when my patients say to me, oh, you don't know what it feels like, I say, yes, I do. I've had one done. And any procedure that my patients may be able to undergo, just to make sure they don't say that to me, I try to go and undergo some of it. So I've had a mammogram, I've been to an MRI scanner, I've been to a CT scanner, which are some of the things that we get people to do so that people don't say to me, you don't know what it feels like. But in terms of when do people get to us? So the first thing is they present usually to their GP. Sometimes we could be speaking to other people and it's just because something is not right.
Okay.
In terms of their breast. Sometimes it could be from the breast screening program, and that is quite important as well because we get a lot of patients through the breast screening program, and it's perhaps the best way to be picked up because things are usually very early at that point in time. Okay. And so once we make a decision,
can I interrupt? Sorry. So the breast screening program, if they go for the mammogram and they discover that they have a lump or whatever, so they refer them directly. They don't go through the GP at all again.
No. Okay. So once there's a problem in the breast, the secondary care facility takes over straight away. Okay. And one of the things we try to do in terms of the breast screening, if there is a problem in the breast, one of the things they do is they get invited to a triple stop clinic. So they have, in addition to the mammogram and ultrasound, and if there's something there, they biopsy it straight away. And with that, within 2 weeks, they'll be seen in a hospital to begin their cancer journey.
Okay. All right.
Yeah. So the usual way they present is that there's a problem in the breast. They've seen a healthcare professional who agrees that there's a problem in the breast, and they send them forward usually to the general surgeons or to the breast surgeons or a triple stop clinic, and that's where things begin. The mammogram is looked at, and if we think that there's a problem, we'll do an ultrasound, and if we can pinpoint what the problem is, we'll do a biopsy, and from there they get called back within about 2 weeks, and we start to discuss things with them. But just so I don't jump the gun, I'll stop there for a minute, except you want me to go on from
No,
there.
go on. Go on. Yeah, go on.
Yeah. So once the biopsy is it's done, and we see that there is cancer there, then the patients get invited back into hospital. Now, although they're likely to see just one healthcare professional, behind that healthcare professional is a team of people. Because once we discover and we confirm that there's cancer in the breast on that biopsy, they get discussed at what we call a multidisciplinary meeting, where you have specialists, including surgeons, radiologists that are able to look at the scans and the mammogram and the ultrasound, oncologists who give their own contribution in terms of how the patient needs to be managed, healthcare nurses who will be the nurses that will support the patient in terms of their journey, and then we make a decision as to what we need to do.
Wow.
And one of the things we then need to do is to complete what we call a staging investigation, because we need to see where is the cancer at in itself. Is it just in the breast, or has it spread to another part of the body? And we try to make a distinction, because if it hasn't spread, then it's been caught early. And what we want to do is to try to achieve a cure. And what we will then do is we bring the patient to clinic, and then we'll have to begin the journey of telling the patient that they do have cancer. And that is the very difficult bit. Because sometimes some people do not even have an idea that they have cancer, and they're being told, and sometimes they're being told there and they are shell shocked because it's not what they're expecting. And sometimes once people hear the C word, a lot of things starts to flash through their mind. In a 30-second space, they will have reviewed all of their lives, where they are at and where they are coming from, where they wanted to get to. They feel some of their life is truncated already. But that's where this breast care specialist nurse comes in, because they are very, very good in terms of holistic care, supporting the patient, helping them to understand their diagnosis, helping them to know what the plan going forward will be. So usually that first clinic is to get to know the patient, to let them know what their diagnosis is, and try to map up a plan in terms of their journey going forward. Sometimes we're not able to do it straight away in that clinic, and they may have to come back, but that will be the beginning of the journey, that will tell them that they have a cancer. We may need to complete some investigations depending on how big the lump in the breast is. And so although they will have had a mammogram and an ultrasound, we may need to do a CT scan to try and complete their investigation.
Wow.
The other investigation that I mentioned earlier, for younger patients, particularly patients under the age of 40, the breast tends to be a lot denser, and therefore a mammogram does not review it completely and fully. And in that instance, we normally recommend an MRI scan to fully examine the breast.
Wow. This all sounds like a lot. I mean, you can imagine somebody that's just been told that you have cancer, and then you now have to do all this. But okay, I'm going to bring Kolia up so she can talk about her experience. Then you guys can chip in here and there. But somebody sent me Joy sent something, say unable to share. I don't understand, Joy. You said, I don't know what you meant by unable to share. So if you could just maybe put it in the comment box, because I don't understand what you mean by unable to share, if you don't mind, Joy. Okay, so Kolia, I'm going to bring you up now. Let me look for you. Okay. So the two other ladies we're bringing up shortly, both presented in different ways. I believe Kolia had a lump, and that's how she discovered that she had cancer. And Ifeoma didn't have a lump. So two completely different cases, just to show you that it doesn't always have to be a lump. Like I think Debisi mentioned that. Oh, right. Okay, unable to share the line. Really? There's probably something going on. Hi, Kolia. How are you?
I'm very well, thank you. Can you hear me?
Yes, we can hear you. Good. Thank you again for coming on. We had Kolia, when was it? Last year?
Last year, yeah.
Sometime last year. So, for those who may not know, have you met Dr. Debisi and Dr. Gbenga?
I know Debisi from Jesus House. But I don't know that, yeah.
Okay, so that's Dr. Gbenga.
Okay.
Right. So tell us a little bit about what happened to you.
So, thank you for having me, Pastor Funke. You know, it's always a pleasure to be here.
Yes. Oh my God.
You know, share my story, inspire women, impact lives, and all that. So 2018, I was diagnosed with stage 3 breast cancer. And it's the hormonal receptive. So you would understand what it is.
Please,
Um,
hang on. What's hormonal receptive? Can somebody tell us what that means?
So there are basically two types of breast cancer. Although when we split it up, there can be up to 4 different categories, and technically they are all different diseases.
Wow.
Some breast cancers can be fed and promoted by hormones that women produce from their ovaries, estrogen especially. And so that can continue to drive the breast cancer. Those are the ones that are called hormonal receptive breast cancer. And
Right.
there are some that do not have the receptors and they are hormonal receptor negative. And the way you treat both of them are quite different. Just to try to explain it, the breast cancer itself is like a TV, and a TV that requires an aerial,
Yeah.
and then you've got a transmitting station, either Sky or Virgin or whatever.
Okay.
If they have the aerial, then they can receive transmission from the broadcaster. If they don't have the aerial, no matter what the broadcasters do, they won't get any reception. So if you then change the breast to the TV, you change the receptors to the aerial, and you change the broadcasting station to the ovaries. So the ovaries produce estrogen, which is what makes women feel like women.
Okay.
And then it stimulates the receptors, and that causes breast cancer to continue growing. And therefore, if you want to treat breast cancer, if they are hormone receptor negative, what you try to do is to try to deprive the receptor of receiving that hormone. Almost the same way that if you don't pay your Sky bill, they can turn off the transmitter and you don't receive.
Okay, I like that. Thank you. Okay. Sorry.
so,
Continue.
so 2018, I got diagnosed with stage 3.
Okay.
I only found out while I was having a shower and I felt a lump.
Okay.
I ignored it because I was more interested in going on holiday and I didn't think it was anything. So went away on holiday, got back. I got a letter to do a smear test. I thought, okay, I'll use 1 stone to kill 2 birds. And I called up my GP and I spoke to the GP. I said, I need to book for my smear test.
Yeah.
However, I found something on my breast. I don't know what it is. He said, can you come in this afternoon? So I had to, they booked me immediately. So I went straight out to the GP and he looked at it. He said, it might not be anything because of where the lump is. It might not be anything. It might be ductal milk or something like a duct or by the milk's nipple side.
Okay.
So, but he said, because you're over 40, I'm going to send you to carry out a mammogram.
Okay.
Have you ever done one? I said, no. So I went, he referred me, within 2 weeks, I got a letter for a mammogram. I went in, did the mammogram. While I was doing the mammogram, I was quite very impatient. I was like, cancer was the least thing on my mind. Wow. You know, I was very impatient. I was like, thank you, the nurse. She did it the first time, but what I paid attention to was her facial expression.
Okay.
So when she was doing when we got in, she had a smile on her face.
Okay.
Then when she started to, you know, they squeeze the breast down and everything, she kept, you know, her facial expressions were like, so I told her, said, is everything okay? She said, yes, you know, then she continued. So when she finished, she said, you need to sit down and wait. I would get the consultant to look at it.
Okay.
So took it into the to the doctor. They said I should do it again.
Wow.
I did it again. And the consultant said they shouldn't let me go. They should carry out a biopsy immediately.
Right.
So when she came in and said, oh, we're going to do a biopsy. I said, what's a biopsy? She explained, needle. I said, needle. So anyway, I went in. Whilst they were doing it, I was so impatient, to be honest with you. My main concern was to go back to work because I went during my lunchtime.
Okay.
So when they started doing it, they had a fault with the machines across the hospital because I went to King's.
Yeah.
And they said, okay, you need to sit down. Once it's fixed, we'll come back. I said, sorry, I can't wait. She said, okay, can you come back tomorrow? I said, okay, what time? She told me. I went back the next day. They took the samples, everything they wanted. Like doctor said, it is very painful, to be honest. It's very painful. So they did all the prodding and all the everything. They took the samples, asked me to come back in 2 weeks. I said, fine. 2 weeks I went in, you know, feeling very joyful, going in, not expecting to hear anything.
Okay.
I've not even, cancer was, I've never heard of, well, I hear of cancer, but nothing.
Someone else.
Yeah, always somebody else and all that. So got into the doctor's room. I went with a friend from work because I went from work. So got into the hospital. My consultant, well, then he wasn't my consultant. The doctor I met, he kept a very straight face. I said, okay, doctor's face, you know, looking straight to his screen. And he didn't even turn. The only time he turned was, can you have a seat? And I sat down. I said, hello. And I was still my joyful self. So he went around, this we did was okay. This we did was okay. I said, okay, cool. Just let me go. That was what I was saying to myself. So after going round and round, he said, anyway, just to let you know, the long and short story of it is you've got breast cancer.
Wow. Wow.
And I froze on the chair.
Wow.
That within a split second, my son came into my mind. So who is going to look after my son? So another woman will come to look after my son. You know, a lot of questions started coming in and tears started to flow down. And I was like, so immediately he said it. I didn't even wait for the man to finish. I said, please cut the breast off. That was the first thing I said. He said, I haven't even told you anything. So he started to explain his stage 3, grade 3. As all these things he was saying, my brain was shot. So I said to my friend, is he talking to me? You better be taking the notes because I couldn't process anything at all. So by the time he finished, I said, there and then I said to him, I want the breast cut off. He said, we could look at it another way. We could start with chemotherapy. And I said, no, I want the breast cut off. And he kept going, trying to convince me.
Why did you want the breast cut off?
Because that was the first thing that came to my mind. That before they tell me it has spread to, you know, it's gone to the east, north, and west, which is, I didn't want to hear all that. So I said to them, cut it. So my thinking, you know, when you cut it off, nothing else, you don't need to worry about anything and all that, from all the stories you hear. Okay. So I said to him, so he said, okay. And when he was trying to convince me, he saw that I was adamant. So he said to me, I said to him, do I have a say in my, you know, in this treatment? He said, oh yeah, you do. Whatever you decide, we will go with it. And I said, my decision is final. Right. So he said, okay. So he got all the MDTs, like the doctor said, multidisciplinary team. I got the nurse, got everybody together within a few seconds, a few minutes. So they started talking me through too many.
Sorry, let me interrupt you for a minute. I'm just going to ask Dr. Saka, is that, in your experience, is that, do a lot of women go for that option?
Like I said, and I think it will also be interesting to hear the story of the other survivor as well, who's slightly more gone down the route more than she has. But yes, for a lot of people, I'm not going to use the word rash decisions, but they make radical decisions straight away there and then because their thought is, it's there, get rid of it. I don't want anything else left in my body. There may be other things that we can say that can change the whole picture on how things are managed, but as far as they are concerned, there's a problem. Get rid of the problem, and that's all they're thinking about straight away, and they take life into 1 minute. Almost like earlier said that you look at your past, you look at where you are, and you look at the future. You are looking at the classic story. Who is going to look after my wife? Is somebody else going to marry my husband? And who is going to do this? So at that point, they make very, very rash.
I just think what she said, who's going to marry my husband? I just think, okay. Okay. Right.
So once it was agreed, and I said to him, I want mastectomy and a reconstruction the same day. He said, are you sure your body can carry it? I said, yes, I know my body can carry it. He said, how are you sure? I said, because I know, I am sure. So anyway, we took all those decisions.
So you did not even take time out to go and think properly. You're just making this decision there and then, Kolia.
How can you be thinking of when they've told you stage 3, not even stage 1, stage 3?
Okay.
And I was told I had a few points. I don't know what he meant by few points for it to get into stage 4.
Right.
So because it has gone into my lymph nodes,
Okay.
and that's something I didn't want to, play with.
Okay.
So I left there crying, came out, called my pastor. I said to him, this is what they've said. He gave me words of encouragement. I went home, got home, brought out all my documents, started to sort my things out. And, I heard my pastor's voice clearly, what he said. I pushed all the paperwork by the side and I slept. And from that day on, I made a conscious effort. I'm going to fight this. And I went on head on. I said, you've come on, bring it on. And, went through mastectomy, did reconstruction the same day.
Okay.
I was meant to spend 5 days in the hospital. Within 2 days, I got discharged. The doctor was like, the nurses were like, this is the kind of patient I want to have in this hospital. Everything was going smoothly. So I thought the hand of God was in it. And I just said, because fear is often fear of the unknown.
Yeah.
So if you can educate yourself, I started to read. I started to look at people. I went online to sites like Breast Cancer Now to read other people's stories, how they overcame their fear, all different people's stories, because everybody's journey is totally different. Yeah. Everybody's journey is totally different. So I went through it. I went through 10 cycles of chemotherapy, and that was the hardest for me. Chemotherapy was the hardest. Hardest in the sense that I do it, come back, I'm full of energy, but by day 2, my whole body system is just compromised. I rest 2 days. After that, I pick up myself. I say to myself, Kolia, you're strong. Just keep going. I pack my bag and I go to the office. Wow. And my boss was like, are you sure you're okay? You're not meant to be here. I said, yes, I want to be here. Because again, I didn't want to sit in the house feeling sorry for myself or people coming to pity party. Oh, can we do? No, I didn't want that. So I was being in the office. I kept myself very busy. Because I cook, people were still placing their order. Even though I didn't have any taste bud while I was doing it, my son was doing the tasting. Yeah. He would tell me if there's enough salt, if there's enough this and all that. Yeah. And I kept on going, taking life as if it was normal. Wow. But the chemo was the hardest. Then after that, I did a whole month of radiotherapy. Okay. Afterwards, after the radiotherapy, I'm now on tamoxifen because it's a hormonal receptor. So I'm on tamoxifen for 10 years.
Wow. Okay, yeah. I guess we'll have to get Dr. Saka to explain some of these things. But I wanted to ask Debisi, I'm going to get you to drop off for a bit so I can bring Ifeoma on. But after all of this, what role do you as a GP play? After you've seen after they've had treatment and all of that, do they refer them back to you or do they deal directly with the hospital?
Okay, yeah, so like I'll just go a few steps back quickly. So like Dr. Saka said, when you go to your GP, like exactly what Kolia said, you will, be examined and then referred on what we call a 2-week pathway. So it's a 2-week pathway, meaning you will be seen within 2 weeks maximum by the hospital. And just to mention that it doesn't mean you have cancer if the GP does that, because the breast clinics, they are so good. They tell you just refer on the pathway. Even we've got 2 pathways. We've got the 2-week ways when like you worry about possible cancer, and you've got the symptomatic breast clinic, and it's still, they see you within 2 weeks. So going to your GP and they tell you you're going to be seen within 2 weeks, don't say, oh my God, I've got cancer now. No. It's just breast clinic sees all their patients that quickly, and they ask us to refer that quickly. So that's the first thing. And then of course, all the management, yes, you get seen in hospital, treated, like what Kolia said, And the thing is, as your GP, you get all the letters. So you
Okay.
get information about the treatment, that they're going to be on chemo. Obviously, when you are having chemo and things like that, you've got you've got like a breast clinic nurse specialist. So
Yeah.
obviously, if you have any problems, you can ring them, but you can still ring your GP if there's something like a prescription that you need or require. Your GP will give you. And like Kolia said, now she's on 10 years of tamoxifen. That prescription will go to the GP. So the GP will continue
Yeah.
issuing it. And of course, in between, even when they've said, oh, yeah, you're now clear and all of that, if there's anything that worries you and you go back to your GP, even if you're still under the breast consultant, for instance, we can write a letter saying, can you see this patient, earlier? Maybe you have an appointment in a year's time and, something's popped up. They're worried and they don't, you could do that, or they could just ring the clinic, nurse specialist, the clinical nurse specialist for the breast clinic. So, yeah, the GP is involved throughout, obviously less so sometimes because you are going into hospital doing all these appointments, but definitely prescriptions like, sometimes when you're going through chemo, you might need creams or emollients. You might suffer from reflux, heartburn. You need medication prescribed like that. Or sometimes you need, simple things, anti-sickness, just general stuff. And generally, the hospital keeps writing to the GP to keep us informed as to what is happening.
Thank you so much.
Yeah.
Kolia, I know you're just a fighter. Even when you were talking, the way I was thinking, my goodness, if this cancer, no, they would have come near you. She's just a fighter. Okay, let me bring Ifeoma up so that she can share her own. And then Dr. Saka, there's so many questions. Debisi, don't disappear completely. I hope this is the right Ifeoma. Let's see. Okay, fantastic. Let's see. Ifeoma, I've sent you a request. Please accept it. Well, thank you, Kolia. Wow. My goodness. Just to be told you have cancer.
Kolia and I seem to be on the same page because we are both wearing pink, which
Yes.
is the color for breast cancer
Ironically,
awareness.
I'll just show you what is written on it.
So,
No, it says smoked, not burnt.
smoked. Okay. Smoked.
We'll talk about that later as to what is smoked, not burnt means.
Doctor, you should know. You should know. What you guys put us through.
It just smoked, but not burnt.
So the Ifeoma should be Ifeoma 132 something. It's
Yes,
Ifeoma
it
with a number.
she's unable to join. Ifeoma, you might need to update your app or your what do they call it? Yeah, upgrade. Not upgrade, update. So or send me a request. Okay, she's left now. Hopefully she'll come back. Okay, whilst we're waiting for her to come back, Dr. Saka, some of these terminologies, we know them. So we know, I know, I hear people say they've done chemotherapy, they've done radiotherapy. What are these things supposed to do? And what are the effects on our bodies? Please explain to us.
So the first thing before we treat anybody is we need to determine exactly where are they at in their in terms of the staging of their cancer.
Okay.
And that's what will determine what treatment they need to have.
Okay.
And usually in cancer, we've got 4 stages.
Okay.
And the first stage is just a way of trying to express how far the cancer is in the body.
Right.
So stage 1, and there's 3 things that we look at. We look at the size of the cancer and where it is in the breast. We look at whether it's gone to what we call lymph nodes, which are tiny little structures that every organ in the body has. And lymph nodes are like gatekeepers. So if you imagine the breast as the house, the lymph node as the gate, and the rest of the body as the rest of the streets.
Okay.
And one of the things you're trying to do is you're trying to see, has the cancer gone into that lymph node? Because if that cancer is gone into that lymph node, it is easy for you to get into the street. So the issue of the gatekeeper is to keep things either within the compound or to stop things from the street from coming in. So we look at the lump itself, we look at the nodes, And then we look at whether the cancer has spread to any other part of the body. And we use those three things together to determine what stage the patient is at. Stage 1 means that the cancer is just about 2 centimeters in size, is in the breast only, and it hasn't gone into the lymph nodes.
Okay.
So those patients can be treated just solely with surgery, and we'll come to the treatment options by itself. Stage 2 means
When you
that
say purely with surgery, so is in they remove the breast, or
I will talk about that in a minute.
okay, all right.
Then we talk about stage 2, where the cancer is about 2 to 5 centimeters in size, but it hasn't gone into any lymph nodes at all.
Okay.
And then you've got cancer that is stage 3, which is where no matter what the size is, it has gone into the lymph nodes, but it hasn't spread to any other part of the body.
Right.
And stage 4, where it has spread to other parts of the body. And the reason why we put all of those staging together is just to be able to prognosticate and see where people are likely to be in a few years' time, and see what treatment is the best option of treatment.
Okay.
In terms of treatment for breast cancer, there are four options that we can consider, either solely, individually, or in combination.
Okay.
So the treatment options are surgery, radiotherapy, chemotherapy, and hormonal therapy. And in some patients, you can give just one and not the other. And in some patients, you have to give the others. And sometimes you have to determine what sequence you need to give it.
Okay.
Surgery by far is the most important, because with surgery, you can get rid of the cancer completely and leave nothing behind, as long as you're able to do it, which is where the staging also comes in. Because if somebody's got stage 4 cancer, it's unlikely you can get rid of all of the cancer completely, in which case all you're trying to do is manage the patient and help them to live with their cancer. All the other 3 stages, you are trying to get rid of the cancer so that the patient is alive and well without their cancer. So
Can I interrupt you? When you say manage the patient so they can live with their cancer, does that mean that when you say live with their cancer, okay, this is stage 4, there's nothing, are you saying there's nothing else we can do for you, but you have to live with that? Is that what you're saying?
So when we say live with their cancer, it means that we will not cure the cancer, but we can make you live longer with the cancer. It doesn't mean there's nothing more we can do, but it may mean that for the rest of their lives, they're on one treatment or the other.
And how long, when you say live longer, could that be like 4 years, 5 years, or?
And that's where staging comes in, because everybody is different. Because apart from the staging, there's other things that we then look at. One, like Kolia said, are they hormone receptor positive or not?
Okay.
And there's another thing that we look for called Her2 receptors, which is which, if it's positive, there's an extra drug that you can get that improves your survival. But if it's negative, while it is meant to be a good prognostic factor, if you combine it with estrogen receptor and it's negative, it tends to have poorer prognosis. And we know that a lot more of Black women have that syndrome, which is technically a different kind of cancer in itself, because usually they may not respond as well to treatment as the others do.
Okay.
Sorry, doctor, can I just quickly ask, what you just said, is that the one called the triple negative?
Yes.
Okay.
Wow. Okay.
I need to go and become an oncology doctor, honestly.
Please go on.
Yeah. So the idea is to determine what is the best treatment option. So for early stage breast cancers like stage 1 and stage 2, you might be able to just go in with surgery and remove the lump completely, and they may not require any treatment afterwards. But usually, if they do have hormone receptors being positive, we will normally recommend them to have these hormone receptors for 5 to 10 years. For some patients, the lump may be it may be stage 3, in which case it's gone into the lymph nodes, or the lump itself is quite large, and you want to try and see, one, can you actually reduce the size of the lump before you offer them surgery? Okay. And there are a lot of things to take into consideration in that instance. One, you're looking at a young woman and you're deciding, do I offer this woman a mastectomy, in which case you take away the breast completely? Okay. Or are you able to actually salvage the breast where you can take out the lump? And sometimes to help salvage the lump, help salvage the breast, you can give chemotherapy up front. It can shrink the lump, and rather than do a mastectomy, you can just take out the lump and still leave the breast as it is intact. Sometimes if lymph nodes are involved and there are multiple lymph nodes, you also want to try and use chemotherapy to sterilize those lymph nodes and reduce the size of it, so that when you're doing surgery, you can take out all of the lymph nodes and leave nothing behind. So in some patients, they'll have chemotherapy up front, followed by the surgery. Now, also in some patients with particularly stages 2 and 3, depending on how close the tumor is to the margin or to the edge of the surgery, you may decide that you want to give them chemotherapy and radiotherapy or not. And if they do have lymph nodes involved in their axilla or in their armpit, we will normally recommend that they have radiotherapy. But just to explain what all of these terms are, surgery means cutting somebody open with a knife and closing them back by suturing them.
Okay.
Chemotherapy means that you are using drugs to try to poison the cancer cells and kill them off while keeping the normal cells alive.
Okay.
Radiotherapy is the use of high energy X-rays to try and kill off cancer cells, and so they can be used in combination with one or the other.
Okay, I'm going to come back because I still have more questions on those chemotherapy and radiotherapy things. And the reason I want to find out more, because I've heard people say that they want natural treatments. They don't want all those things that they feel will damage their body. So we'll come back to that. Ifeoma, welcome. Thank you for agreeing to join us today. Can you hear me? Ifeoma, can you?
Yes, I can. Yes, I can. Yes, I can.
Right.
It's breaking off.
Thank you for joining us.
Hear you.
Okay, but you can hear me now.
Yes, yes.
All right.
Okay. Yeah.
So I know you know Dr. Saka. Meet Kolia. Kolia.
Hi,
Ifeoma.
Hi, Kolia.
Okay, so
we seem to have similar stories. Yeah.
Sorry. Okay.
Go on, Pastor Funke. I can hear you.
So tell us what happened to you. Tell us. Share your story with us.
Okay. In 2016, I was diagnosed with breast cancer. Unlike Kolia, I didn't have a lump. It's what Debisi was saying on the phone about, getting the screening invite.
Okay.
I got a screening invite out of nowhere. I just saw it. I thought, oh, okay, I'll go for the screening. It's not costing me anything, so why not? So I went for the screening. And it came back 2 weeks later, and they said it was inconclusive.
Okay. Come on. This it came back inconclusive. Come on.
It looks like this is internet connectivity more than anything else.
Yeah. Okay, let's see. Whilst we're waiting for her, I know we have some questions. Dr. Saka, where can we find out more about the British American Oncology Group?
So at the moment we have a little handle on Twitter, because we are still very small. We don't have a website as at yet, but we'll start to work on that. At the moment, there are just about 10 of us, and we are all Nigerian origin oncologists based in the UK. One of us actually gone back to Nigeria now, just for 1 to 2 years stints. Okay. One of the things we've done at the moment is we've embedded ourselves with 2 big cancer centers in Lagos. Okay. And we sit under a multidisciplinary meeting once a week to give advice on how best they should manage their cancer patients. Okay. While not plugging any hospital, and I'm not saying anybody should go to any of these 2 hospitals, but there are 3 main cancer centers in Lagos at the moment. You've got NSIA Lutz Teaching Hospital, which is a very big hospital supported by the government, and the other 2 are independent hospitals. The Marcel Roots Cancer Center in Victoria Island, and the main proprietor used to be a hematologist here in the UK, and is the daughter of the owner of Lagoon of the Lebute families, but they've established a cancer center in Nigeria, which is brilliant. And the other is Lakeshore Cancer Center, whose chief executive is a professor of surgical oncology from the United States, and they are allied with Roswell Park Hospital in New York. So between those 3 centers, you have a very good coverage of cancer care in Nigeria. And the only problem with cancer care in Nigeria, unlike the UK, where whether we like it or not, we should be grateful for the NHS.
Yeah.
Yes.
Irrespective of what people say, the NHS is a brilliant organization.
Yes,
we have our imperfections, and yes, we need to think about the fact that we cannot fund everything. Yeah. But what people get on the NHS, you have to try and take the same things elsewhere and see how much it will cost you to try and get this care. So the cost of treatment in Nigeria is still exorbitant.
Yeah, yes, that's so true. Okay, I've sent in another request to Ifeoma, but another question was asked. It was okay. Is she back? Okay, let's share the story before the internet goes again. So you said the result came back inconclusive.
So sorry. To think that I work from this house today is just a very poor show. Really sorry about that. Can you guys hear me now? Are you guys able to hear me? Okay. Okay. Sorry, Gbenga, I cut you short. So I went for the test, for the screening. 2 weeks later, when it came back and they said it was inconclusive, I went to a local clinic to have the test done. And it was interesting because I think like Kolia, I wasn't expecting anything. It was an inconclusive test. I've had a mammogram before that was inconclusive, and that wasn't cancer or anything. So I just went quite confident that I'll just do this and that's it. And I got to the clinic and they did a mammogram. And the nurse, I like what Kolia says about, looking at their faces. The nurse came back looking a bit confused and basically said, oh, I'm really sorry because we have to do it again. So we have to do a scan. I thought, okay, a scan, all right. So they did a scan. After the scan, nothing. The next thing I heard, she said, oh, the doctor would like to see you because we might have to do a biopsy. And at that point, I thought, what's going on here? This should be a simple thing that I just came in here. I just need to walk away. Anyway, I got in for the biopsy, and that was painful. I mean, mammograms are uncomfortable, but biopsies are just painful. And this young doctor that was doing the biopsy, I was getting really impatient with her because she just seemed to be poking my breasts here, there, and everywhere with this needle. And I was like, what is she looking for? But in the end, she got what she wanted with, and I left. But at that point, in being honest, I had started feeling uncomfortable because you don't just go to a mammogram and end up having a biopsy. I was feeling uncomfortable, but I still didn't think anything of it. So I just went home, carried on planning my my holiday with my kids. We were going for a wedding in Amsterdam, and that's where my focus was. And then a week later, I was meant to go back. That was the day before I traveled. I drove to the hospital, to the clinic, and got in. And I think it was the reaction of everybody that kind of made me think, what is going on here? Because normally it will be quick. But this time around, I was told that the doctor will see me. Why is the doctor seeing me? Anyway, I got into this room. There's the doctor, and there were 2 nurses in the room. And something said to me, this isn't good news. But I sat down and the doctor did what Kolia was describing, tell you the whole story about everything they did, what they found before they get to the real story. And in the end, he basically turned around and said, we took 2 biopsies. This one was all right, the right one, yeah. And then he said, but. And he said, it's malignant. And I was just looking at him. And he looked at me. I think he thought, she doesn't understand what I'm saying. He went, do you understand what malignant means? I said, oh, maybe you could explain it to me. And he said, it's cancer. And I thought, my goodness. Okay, I think I knew what malignant meant, but just hearing that word cancer actually, and I just sat there and I looked at him. I didn't move, I didn't cry, I didn't shake. I was just looking at him. And I think the poor man kind of felt, don't know what to expect with this one. She's not reacting. Do you really understand what I'm trying to explain? And I said, you know what? I think I do. And he said, okay. And then he started talking about, all that was available. And he said, would take me to a room. And it was at that point that I thought, okay, so I got up to go with the nurses and they said, can we make you coffee? You know, immediately they had started treating me as a patient.
Right.
And I was still processing what they had just told me. But they had gone into the mood, you know. But for me to really understand, so they said, can we make you a coffee? I said, no, I know where the machine is. I'll make my coffee. So I went to the machine, stood there for a couple of minutes, made myself a coffee, and then came back into the room with them. And they started talking about hospitals and doctors and treatment. And I was just looking at them. And I thought, what's going on here? Because in my mind, I was just saying, God, is this real? I mean, are they telling me a story? Is this for real? Have they just told me I have cancer? And you know, after a while, I didn't hear half of the things they said, if I'm being honest. I think the only thing I heard was they said I needed to choose a hospital and I needed to decide on a doctor. What do I know? You know, choosing a hospital for what? All of those things were playing in my mind. And I just said to the nurses after a while, I said, you know what, ladies? I said, I need to go home. I just need to go home. I said, because when I came here, I wasn't expecting this. I said, there's only one person I know that knows about this, and I need to go and talk to him. I need to go and talk to my father. And they looked at me strangely. They said, your father? I said, yeah, my father is God. And he's the only one that knows that you will give me this news. So I really just need to go and have a conversation with God right now. That's all I need. And they said, oh, can we call somebody to pick you up? I said, no, I'm fine. I wasn't ill. There was nothing wrong with me. I still didn't feel anything. It was just this news that when they give it to you, you begin to think all sorts. And in those couple of seconds, everything flashes before you. So anyway, I left the clinic and I got into my car and I really did have a conversation. Thank God I did, because I just said, they've just told me I have cancer. Is it me? Or were they kidding? Anyway, I just recalled a word that God had given me prior to that, which was that I should thank him for my future. So I just turned around and said, you told me to thank you for my future. Right. Which means I have a future. If I have a future, it means the cancer will not kill me. Okay, I'm going home then. So I got in my car and I drove home. You know, as I drove home, the one thing that kept playing in my mind was, what do I tell my children? Because we are traveling the next day. What do I say to these kids when I get home? And by the time I got to my door, I had clarity in my mind that I told them nothing. So I told my children nothing. I got into my room, my husband was home, and I told him. And, you know, I don't know between us who was more shocked. But that day, my mind just, I then went shopping with my son to go and get the stuff he needed for his holiday. When we got to the shopping mall, he picked up what he needed and he said, Mom, are we going home? I said, no, you can go, let me walk around. And I started walking around the mall. After a while, I sat down at a bench and still having this conversation. It was at that point that I thought, okay, call my group leader in Jesus' house. I called my group leader and I said, this is what news I've heard today. She prayed and I left it. And I told her, I said, tell this pastor, I don't want anybody knowing. Don't tell anyone else, just this pastor. You guys pray for me. I'm going to Amsterdam tomorrow and I'm just going to go to Amsterdam. It doesn't matter. So the next day we traveled. And for some reason, I had to choose a hospital. So I called my friend who's a pharmacist, whose sister had just died of breast cancer a few months earlier, which was horrible. But when her sister had breast cancer, she had done a lot of research. So I immediately thought, actually, I don't know a lot of things about breast cancer, but she does. So I called her and I said, they told me to choose hospitals. What do I know about hospitals? So she said, hold on. Within 5 minutes, she said, choose Royal Marsden. So I basically sent a message to the clinic that evening. I said, Royal Marsden. I forgot that I was supposed to choose a consultant as well.
Okay, I think.
So it was only as we were.
How many years ago was this?
Yeah.
How many years ago was this?
This was 5 years. 5 years, exactly.
Okay,
5 years.
Saka, is that what they still do nowadays? So you
Yes, so there's still the opportunity to do choose and book when you're coming from a primary care center. So if you go for a mammogram and you go into your local district hospital,
yeah,
and that's where they've told you, then you get the opportunity to do choose and book. But if your GP has referred you directly to a hospital,
yeah.
the opportunity for choose and book may not be there. Although it can still be exercised, but you can say, I don't want this hospital, I want to go to a different hospital.
Okay, what about in terms of choosing a consultant?
You may not have the choice to choose a consultant, because what tends to happen is there's a pool of consultants, and it's whoever is available that may pick you up, that may be able to pick you up.
Okay, all right. Okay.
Yeah, so I didn't know the consultants. So I went online, I looked up all the consultants at Royal Marsden that dealt with breast cancer. And I was just praying, Holy Spirit, you just direct me, because I don't know any of these people. At the time, I knew Dr. Saka. But what I didn't know about Dr. Saka was that he was an oncologist, because he would have been my first port of call. But I didn't know at that point I just knew him as a doctor. And he was my friend. I never even found out what he did properly. Anyway, I chose this consultant and I sent to the hospital and I traveled. That whole weekend, I spent dancing at the wedding. You know, it was almost as if you're dancing for your life. I just had this thing about it. Was just, my children didn't know. My friend who I was at her son's wedding didn't know. But I danced my heart out. And as I was there, I said, God, I am going to dance for my children's wedding. This thing, I refuse to accept this fear that cancer brings. But, you know, I was in Amsterdam that same weekend. I got the diagnosis on the Tuesday. On Friday, they called me and they said, you have an appointment on Monday morning. It was that quick. It was very quick. So I got back from Amsterdam on Sunday. Monday morning, I was in Royal Marsden. And then they told me what sort of mucinous, whatever, what do they call it, Gbenga? You know the name of this thing more than I do. They told me the cancer that I had, it was the invasive mucinous carcinoma, which of course I don't know what it means, but
what exactly
it was.
Doctor?
And
so
you know,
when you look at
Dr. Saka,
so when you look at the cancer cells under the microscope, you are trying to look at the characteristics that it exhibits. And so the first thing you're trying to look at these cancer cells. And sometimes the way I say it to people is that you can imagine cancer cells as an army marching band. They march in an orderly fashion. That's what we call well-differentiated cancer. You can imagine boys on a school field in assembly. They are a bit rowdy, but they are not uncontrollable. That's what you call moderately differentiated cancer. Then you can imagine a football stadium where people have had their drinks and the players are all rowdy, totally uncontrolled. That is the way you describe polydifferentiated cancer, because when you look at the cells under the microscope, they are completely disorganized. But in addition to looking at the order in which the cancer cells are, you're also trying to see what are they secreting around themselves. Is it just clear fluid, in which case it's just what we call adenocarcinoma, or are they secreting things that are like mucin around it that makes it a little bit gel-like, in which case they are mucinous adenocarcinoma. But I don't want to turn everybody into an oncologist here today, otherwise I won't have a job to do tomorrow.
You know, as we're talking now, before Ifeoma goes on, it just occurred to me that's why, how do I put it now? You know, you hear sometimes that someone passed on from cancer, and then another person is told you have cancer. So automatically you think, oh, that person passed on from cancer. But then we don't think about the different types of cancer. Even if it's breast cancer, like you said, there are different types. So, and one could have been the more aggressive type, you know, so we really need to, but is it something, well, I'm sure it's probably something that the consultants do when they tell you you have cancer. Do they tell you this one? Do they immediately say that this one is more aggressive or this one is not? Or so that people at least can have that at the back of their mind that, okay, it doesn't mean I'm going to die from this thing.
Which is where the staging comes in, because at the staging you're able to tell people exactly where they are at. So if somebody has stage 4 cancer, you're telling them, I'm sorry, you've got cancer. We can't cure you, but we can treat you. The aim of treatment will be to keep you alive, but it will not cure the cancer, and you have to live with the cancer for as long as possible. But sometimes there are times when we look at the cancers under the microscope and we'll say, look, this kind of cancers don't respond as well to treatment. And sometimes it's difficult for us as well, because you're sitting before another human being and you're telling them you have this amount of life left to live. It's difficult, and it's even more difficult, and I hate to say, when you're a Christian, having to speak to another Christian who brings the issue of faith in. And when they bring in their issue of faith, it's almost making you doubt that, look, do you believe in the same God that they believe in? Because how can you be so factual in telling somebody? So if somebody has breast cancer, for example, that spread to the liver, that spread to the lungs, and that spread to the bones, I will say to them, look, if you don't have this cancer treated, you may have less than 3 to 6 months to live. And somebody is telling you, but you are not God. And say, yes, I'm not God. On the other hand, somebody comes to you almost with a 2-centimeter lump in their breast, and you've cut up with it early. You just take it out and you say, look, if I had 100 people like you and I followed them up for 5 years, I'll expect 95 to 98 of them to be alive and well without their cancer coming back over a 5-year period. And so that's why we do all of the staging. But the other things I would then throw into it, because the hormone receptors, being positive or being negative, can affect that value. The Herceptin receptors, being positive or being negative, can affect that value. Being mucinous or non-mucinous can also affect the value. Age, in a way, plays a role in the whole thing as well. People's faith, because it's usually useful to have faith, because when you have faith and you have people around you, you can devolve the burden of worrying onto them and carry on living and let some other people worry about things for you, because sometimes worry itself can significantly affect how people feel. It can send you into depression, and when you are depressed, you don't look after yourself. Sometimes you don't take your medication. Sometimes you start to think, what is this whole thing all about as well?
Yeah. It's interesting you talked about this, having people around and the support and fear, because I think Dr. Dilby mentioned this last week, that talked about fear, that fear actually, people without fear, I think he said, can probably live longer than those who have fear. And then I think he also mentioned faith plays a lot. Faith helps anyway in this, when we have this kind of thing. Okay. Yes.
Can I say, just on that point, I think it's not just talking to people, it's talking to the right people.
True.
Because there are people who will input their fears on you.
Do you know, I read something where it was saying that sometimes when you talk to people, that's when they now start to say, and I know this, last week, this person died from cancer, or that person died. So put more fear in you.
Yes. There are people that just put more fear in you. And I think when I went through this process, I was quite particular in deciding who I told and when I told people. Because even for your family members, Dr. Saka knows that I didn't tell my brother until I had gone through it all. In fact, I told him probably a year after, because I know he would be fearful. So there are people that you don't tell because they don't intend it. The whole pity thing, I think Kolia called it pity party. People come, they have all the right intentions, but actually all they're doing is telling you things that will just bring you down without knowing it. So for me, it was about keeping myself upbeat, keeping myself busy, keeping myself focused, talking to those that helped me. The other thing that helped me was, when I told Dr. Saka, he confirmed that the hospital was right. He confirmed that the consultant I chose was the right consultant for me. I was at an early stage. So that was really helpful. It was stage 1, so too bad. But I think it's the fear that cancer brings. Faith, it does require faith. Because if you didn't have it, I don't know where I would have gone. People can tell you it will be all right. I remember one day my husband was just saying, it's okay. And I went, how do you know? You can't just tell me it's okay. It's an empty word. You know, you need something to back it up. You know, and people will like to tell you, it's okay, it's fine. It's not fine. I'm the one going through it. I know it's not fine, but I need that anchor in God. That's really what got me through. So I kept a diary daily, wrote what I was feeling, wrote what I was thinking, wrote what I was finding out. And I read quite a lot. I never read books on cancer, but I did that. I read a lot about cancer. One thing Dr. Saka said to me in that period, he said to me, don't go and read all the things you see on the internet. Don't believe everything you see. Yeah, don't Google it. He warned me, do not Google it. So I said, okay. So he sent me one document and he said, this document, that's the only thing you read. Anything else you want to find out, call me. Do not go Googling things. He kept me on my toes in that, and I did. I registered with cancer, what is it called? Cancer, one of the cancer charities, I've forgotten which one. Initially, because that's what they tell you, they give you all these leaflets. And when I went there, the first I went there, I started reading story. And you know, I was so down. I told myself I will not go back to this site again. Because people kind of own the cancer. And I didn't want to own this. And I thought, I'm not owning this. You know, people say to you, my cancer. It's not my cancer. I refuse to accept it as my cancer. It's not mine. So I stopped, you know, I stopped going to the site. I decided I'm not going to own this. It's not one of those things you give to, you know. So I think everybody is different. I had surgery within 3 weeks of diagnosis. I didn't go through chemotherapy. I went through radiotherapy. And between surgery and the radiotherapy, I was still able to travel. I went to Nigeria, did my mom's 80th and came back. So I was sufficiently well. And even when I was in Nigeria, I didn't tell anybody. I had just come out of theater, literally on the flight, and came to Nigeria. But I was well. And I think if anything I'll say to anybody is, you may not have a lump. But it's like Dr. Debisi said earlier, check for anything unusual. I didn't even have the unusual.
Well, I think she said.
So when you get that letter that.
No, I was going to say, I think the key thing she was trying to say is to know what is normal. So that the thing that is not, when the thing that is not normal presents itself, you can tell this thing is not. So no, I guess it's for us to know our body.
Know your body. Know your body. Our bodies are always speaking to us. Just know your body very well. And even if you are like me, that you just get that letter through the door and nothing is wrong with you. Take the test. It doesn't kill you. Go for the screening. It might be uncomfortable, but that is really important.
Sometimes,
if I didn't, I probably would be dead.
I don't know why we do this thing where, nothing can happen to me, and especially Christians, we do that.
It's not my portion syndrome, Pastor.
Say that again.
It's not my portion. It's not my portion syndrome.
It's not my portion. Yes.
It's not my portion.
It's not my portion.
Yeah. It's not my portion. But you see, I countered it with this. The one story I used, and I put it in my book because you know the story of Hezekiah. Hezekiah said to God, when the king of Syria was threatening, Hezekiah said, you know what? This man has done everything he said he will do. He has done it to all these countries. So it's not a joke. The man is not kidding. He has burnt down cities and all of that. He said, but those people were not God. You are the God of heaven. And that's what I took. I said, God, cancer kills people. is dangerous. Cancer brings fear.
Yeah.
There is no doubt about it. I said, but I don't want to be afraid. And I know I am not going to die in this cancer. So I'm hanging on to you because you're the God of heaven. We have to accept what the reality is.
Yes.
Faith appropriately.
Absolutely.
The reality is I had cancer, but I refused, given what God has given me and given the medical facilities and opportunities that I have, that I will take advantage of it. And that's what we must not do. People say, it's not my portion. You sit down. It's not your portion. Your body is dying. It's not your portion. Well, it's not. Christians must learn. We really must learn how to apply our faith.
Okay, let's
we really must learn how to apply.
We really should. I absolutely agree.
Can I just buttress a little bit on what she's just said?
Yes.
Because I always give a very clear illustration when people come to me and say, oh, I've not had paracetamol in 20 years. Like, kudos to you, you know. However, I always say to them, do you know the very first surgery that was ever done in the entirety of the world was done by God? When he put Adam to sleep.
Yeah.
That is anesthetics.
Yeah.
When he opened him up, that is surgery.
Yeah.
He took out what he wanted and closed him up.
Yeah.
And that is when you go into the recovery position. So I always say when people come to me, I just give them that illustration. I think you go back and battle with your mind, you know, if that's what you want to deal with. Because if God can do that, then he's giving the doctors the wisdom.
Yes.
He's giving them all the tools.
Yes.
And Luke in the Bible was a medical doctor.
Yeah. Yeah.
So how are we going to dispute the fact?
Yeah.
If God had all these people, then who am I to say when they say, like she just said, you don't own it.
No.
But you accept, okay, they've said this is, how am I going to, go ahead?
Yeah.
Life can be very tricky, but if you have the right tools to navigate the tricky aspect of it, you know, then you've got the good things to go ahead.
Absolutely.
You know.
Absolutely.
And I will also say to her, doctor might agree or disagree with me. I always say to women, if one person in your family has gone down this route, I think it's always good to go and do what is called a BRCA gene test. Just to find out. It's always good.
Angelina Jolie.
You just go and do it. Is whether it's just to find out if it's in the lineage. So, because someone like me, I'm the first in the whole of my lineage, my family. So somebody else might have it without them knowing. Because it manifested in me. So God has used me to expose it. So people would be aware of it within my,
Okay, I can hear feedback from you, Kolia.
Yeah.
Dr. Saka, do you agree with what Kolia just said?
Yes and no.
Okay.
It's a good thing to do to know if you're BRCA mutated or not, because the BRCA mutation is, it's one of the things that patients don't see is when you come to clinic and the doctor spends 20 minutes with you just to say, this is what we found, this is what we're going to do. You do not realize how much has been invested to arriving at 20 minutes with you. So it seems like, oh, I only spent 20 minutes with the doctor. The pathologist spends a lot of time trying to understand that cancer. Okay. What is that cancer? What is the origin of the cancer? But also we try to look, who is the patient that we're dealing with, and what is the risk the patient has, and what is the risk of the rest of the family. So if somebody is presenting for the first time at the age of 80 with their breast cancer, it is unlikely to be BRCA mutated. It is unlikely to be familial. Okay. If somebody is presenting with their breast cancer under the age of 40, we get very worried because that could be a familial cancer, and that could be the first person that starts to have cancer. So at that point, it's usually worth doing it, and we do it. And if we have two people definitely in the same family who've got breast cancer under the age of 40, or breast cancer and ovarian cancer under the age of 40, even if they're first cousins, that starts to ring alarm bells in us. And in those patients, we definitely do the BRCA mutation.
Okay.
The benefit of doing that is that BRCA mutation can also herald other cancers as well. So breast cancer and ovarian cancer in women, it can also increase in men. It can maybe risk for breast cancer and prostate cancer as well. So we just know that BRCA mutation is a very nasty mutation to have, and therefore it's worth looking for, but it's worth looking for in the right patient category.
Okay. All right. Thank you so much. I don't know why there's now this. Can you guys hear the feedback?
There is a feedback,
Yeah.
but yeah.
I don't know where it's coming from now. Okay. Wow. There's just so many things to talk about. Well, something that just also occurred to me now, I don't know whether Dr. Debisi too, maybe I should bring that on. I was wondering, with this cancer or any type of cancer, is there anything, Dr. Saka, from your experience, that we can do to prevent it?
So in terms of cancer, there are things you can do something about, and there are things you can't do anything about. But the ones that you can do something about, please do. Smoking doesn't increase the risk of breast cancer, but if you don't smoke, don't start.
Okay.
And if you are smoking, please stop.
Okay.
But the other things that can increase the risk of breast cancer, lack of activity. So people that lead sedentary lifestyles, that are not too active, that can increase the risk of breast cancer. People that drink alcohol, that can increase the risk of breast cancer. We know, for example, that using the oral contraceptive pill can increase the risk of breast cancer. And people that do start their periods very early and finish their periods very late can increase the risk of breast cancer. But this is something that people will not be able to do something about at all, because it's not in our gift to determine when period starts or when period ends. The other things that can increase
Dr.
the risk
Saka,
of...
just hold on a minute. Kolia and Ifeoma, can you drop off? Let me see if the volume will be okay. So if you drop out, I'll bring you back later. Let me see if, because it's echoing. Okay. Ifeoma, can you drop off, please?
Is it me?
Can you drop off? Just
Okay.
so that we can hear Dr. Saka clearly. So just click on the cross on your thing, I think. Okay. So
just to recount that, being overweight and being inactive, drinking alcohol, using the oral contraceptive pill can increase the risk of breast cancer. And I'll explain that together with the use of hormone receptors, with the use of HRT for people whose periods have stopped and have menopausal symptoms and are taking HRT.
Okay.
And then we go back to people that started their periods very early and finished very late,
right,
and people that have never had children. And all that this means is that people's breasts are being exposed to estrogen that is produced in the ovary without any interruption. So that prolonged exposure to estrogen can increase the risk of breast cancer. The other things that people can't do anything about, family history.
Yeah.
But even if you can't do anything about it, you can be very conscious about it.
Okay.
So you need to take extra care. We know, for example, that people that are diabetic may have a slightly increased risk of breast cancer. And people that had other breast diseases, either lumps and bumps in their breast, may be at a slightly increased risk of cancer.
Okay.
For people that have very, very dense breasts, in which case when they do palpate their breast, which is where it becomes useful about knowing what the breast is like, knowing what is normal for everybody. Everybody is different. And if you start to feel your breast, people say, what am I looking for? You're not looking for anything. You're just getting to know your breast.
Right.
And the idea is that if there's any change in it, you then know that change has taken place. So people that have very dense breasts can have increased risk of breast cancer. For some reason that we cannot explain, and please, people should not hold this against me, taller people tend to have breast cancer than shorter people. We don't know why.
People, really?
Yeah.
Okay.
So, and then the other things that ethnicity can affect breast cancer. We know that whites tend to have more breast cancers than black,
Oh,
but
really?
the outcome for blacks are poorer than the outcomes for whites.
Okay, hold it, Dr. Saka. There was a question about ethnic. Okay, why do ethnic minority patients seem to have more resistance to some cancer treatment?
Okay. So there are a lot of things to say about ethnicity. One of the things about ethnic groups is our faith. We tend to believe a lot more in our faith,
Okay.
and we take faith over and above standard medication. If you send out 100 invites for mammograms to 100 whites and 100 blacks, I can guarantee you at least 95% of the whites will take up that mammogram. It could be about 50 to 60% of the blacks that will take up that mammogram. And even when people see something in their breast, so a white person will see a lump in their breast, then their GP straight onto their GP straight away. The GP is saying, I'll see you in 2 weeks. They're telling the GP, I'm coming to your office now, whether you like it or not, you can see me. The black person sees something in their breast. I wonder what that is. Okay, I'll look at it again next week. Something else takes over their mind, and they put it, oh, I'll pray it away and it will go away. Maybe it's just, and then by the time it presents, it becomes something quite difficult. And then in addition to that, we know that the kind of breast cancer that can occur, particularly in Black Africans, is what we call triple negative, meaning that it doesn't respond to hormones, it doesn't respond to biological therapy. So it can be a bit more difficult to treat. So the earlier it is picked up and treated aggressively, the better it is compared with what you may find in white people.
Wow. Oh my goodness. Whoa, 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 whoa. Okay. This is okay. I think there's another. Any more questions, folks? Let's okay, I think you've answered this. There's a question on what are your thoughts on Christians who refuse cancer treatments because of their faith? What would you say, actually, Dr. Saka? What would you say? People who remember I said I was going to ask you. Some people don't believe in. They say they won't do chemotherapy. They won't do radiotherapy. They want natural treatment. What would you say to them? And also those that say because of their faith that God will heal them, so they're just going to have faith. In fact, we know that somebody died about 2 or 3 weeks ago. She's refused treatment and also didn't tell anybody. So what would you say, Dr. Saka?
It's difficult, and I know these are questions that I've thrown at Pastor Agu and Pastor Shola as well. And sometimes one of the things is when I do a consultation, I never advertise to anybody that I'm a Christian. And even if you come into my room and you tell me that you're a Christian, I still never say anything to you.
Okay.
In my mind, I continue to pray, but I want to remain as professional as possible. So there are two streams then we then need to look at. We can look at the physical healing of the body, and we can look at the spiritual healing of the body. The spiritual healing of the body takes place between that person and God. The physical healing can come from me, directed by God.
Yep.
So one of the things that happens is, like Ifeoma said, she prayed to have the right consultant to treat her.
Yeah.
And when it comes to consultants, sometimes people get along very well.
Yeah.
Sometimes people don't get along. You just meet somebody and the two of you just don't get along. So the idea is that you don't meet somebody that you don't get along with. Sometimes you meet people that can listen to you and are willing to listen to you. And sometimes you meet people that all they're just happy to do is just to offer you a solution without trying to find out what you think about the solution. So this is the solution, take it, go away. And when people bring the issue of faith, and almost like Kolia said at the very beginning, what is faith all about, and what is faith allowing you to do, and what is faith not allowing you to do? Adam could have been awake and alert when God was taking the bone from his side, but it says specifically God put him to sleep.
Yeah.
So that is a form of anesthesia in itself. We know that when the Israelites were crossing, when they were in the wilderness and they had their bitter water, and God told Moses to do something. Was it throw a stick in the water to change it at Meribah, so the water became tasty again? And we know that same thing happened either with Elijah or Elisha, where they did something to try to cure people of ailment. So there are lots of things to be done. And then I think when we also look at Jesus, there are 4 things that he did about people's eyes that were blind. To one person, he spoke and they saw. To another person, he told them to go and do something and they did it. To another person, he spat on the ground, mixed the mud, put it on the person's eyes, and they saw. So different things work for different people. I can only talk about what we can do and the effect of it. So I'll say to you, if I give you this drug, this is the likelihood that this drug will work in you. This is the likelihood that it may not work in you. By all means, it's always useful to have faith. but I don't think someone should use faith to interrupt the treatment that they are going to get. It could be because God loves the person so much that God has directed the person to go and see a particular person, and that can lead them onto something. I mean, and it pains me, for example, when Christians refuse medication, because sometimes I'm there with other people that are not Christians. I'm thinking, is this a good advert for Christianity? I mean, I had a young lady, which really pained me, who was in her 40s, who had children that were teenagers, and not breast cancer, but she'd come with a different cancer. She refused to accept the diagnosis. It's not my portion. My God does not deal in cancer. And even if this is cancer, this girl is not going to die of cancer. Gave her everything that she needed, and she's a Nigerian. Gave her everything that she needed to know. No, she declined it, and she died within 4 weeks. And I basically told her point blank, you don't have any treatment. You will die within 3 months. You have treatment. It might even keep you going for longer, but she refused. And when she died, and I was told, it pained me because one, she's a Nigerian, two, she's a Christian.
Wow.
And I could have done something for her. I might not have cured her cancer, but I might have made her one live a little bit longer, put her affairs in order, sort out her children.
Folks, please, 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 even if we all have faith, but God, like as we said, God will use the doctors. He's the one that's given them the wisdom. Oh, gosh, we could go on and on, but Dr. Saka, well, I know we're probably going to have another session, because apart from breast cancer, like you said, there are other types of cancers, which I think we should also talk about. Which one, I don't know if you know the statistics, but which one has the, what's the word I'm looking for now? Oh God, I can't remember what I was trying to say now. But anyway, we'll bring you back to come and talk.
Happy to talk anytime.
Yes, please. To come and talk more about this. And it's not because we want to put fear in people, it's to raise awareness. I mean, look at, you've talked about what to look out for, and the treatments available. And I love the analogies that you keep giving, the different types of analogies. And it's easier for us to be able to understand when you present the things this way. So really, really do appreciate you. Dr. Debisi, thank you so, so much. Folks, please listen. Early detection is key. It is so important. I'm sure, Dr. Saka, you will agree that there are lots of things that we don't have to go through if we detect them early, right? I think, like Ifeoma said, she didn't have to do chemo. She only did she do radiotherapy?
Yeah, so part of Ifeoma's story, which is slightly different from Kolia as well, when she was told that she had the cancer and she got to the hospital as well, she did the same thing that Kolia said, take everything off.
Yeah.
That's what she told the surgeon.
Okay.
And then she came to me and she told me, and I said, you don't have to take it all off. Which is why it's good to surround yourself with people that knows things and can encourage you. And she has a good reason for saying take it off. It's just because she doesn't have to worry about anything again.
Yeah.
But one of the things I then said, look, it's easy to say take it off, but think about yourself, but also think about your husband.
Yeah. Yeah.
Because your husband wants to wake up every morning and then have to turn his back when you're dressing up. And they're giving you an option saying that we can take a bit of it away.
Yeah.
Leave the rest of your breast. Yes, you need to have some other treatment, but you still preserve your breast. So talking to other people that do know you does allow you to make some more informed decisions.
Yeah. And Ifeoma's was stage 1, Kolia's was stage 3.
Stage 3.
Yeah. So it doesn't. It's good. I mean, find out from people that know all this information. And I'm glad that Ifeoma took your advice not to start Googling all the things about cancer on the internet. Because these things are put, a lot of times they're not put by medicals, they're put by people who have been through it. It's like, this is what happened to me. But we're all different. But thank you so much. Really do appreciate you. Dr. Debisi, hopefully you're still on. Thank you so much. I appreciate you loads. Kolia, fighter Kolia. Thank you. Now, Kolia has written a book called Scared. Kolia, please put it on the thing for me, please. Scared but not scared. I can't remember.
Smoked but not burnt.
No, not smoked but not burnt. That's no. It's scared but not. Scared but not. I can't remember what it is. But Kolia, please put it on for us.
Same thing with Ifeoma as well. She's written a book as well.
Ifeoma's what's your book called, Ifeoma, please? Can you put it on the comment thing for us too? And both books are available from Amazon. Yes, that's Kolia's own. Scared but not scared, yes. And it's available on Amazon. Ifeoma, what's yours called, please? I can't remember. You should put that on the link for us too. Please buy their books. And Ifeoma, I'm waiting for you before we go. What's your book called? And yes, so please, if you want, I'm sure Dr. Saka won't mind if you want to reach out to him to ask for more questions. His handle is, what's your handle again?
Gbenga Saka.
Gbenga Saka, okay. Gbenga Saka. So reach out to him if you've got questions. Someone asked Dr. Saka, oh, I forgot to ask this. In what situation is an MRI recommended after a mammogram?
So usually in people under the age of 40 whose breasts are still very dense, the mammogram does not provide the best sensitivity and specificity. So you're using the MRI scan to try to understand the breast a bit better. And sometimes if we are not quite sure, because sometimes what you're looking for in the breast is you're looking for what is called calcification, which are just tiny white dots in the midst of the breast. And if you're not quite clear, then we'll do an MRI to try to stage it better.
Okay, thank you very much. Okay, Ifeoma's on is his piece in my storm. Is it 365 days of cancer or what's the G35 days of cancer? His piece in my storm. But look, it's on Amazon. And the final question someone asked to do it, the British Nigerian Oncology group. I think she said, is it just for medics or can non-medics in the field volunteer joining?
At the moment, it's still for medics only. As we increase our capacity, then we'll be asking for volunteers. Because one of the things that we're struggling with at the moment is that all of us in there are full-time working doctors, so there's nobody free to maintain the website regularly.
Okay.
But the idea is, if people do have any questions, we'll try and make our presence a little bit more known and felt. They can send it to anyone in the group.
Okay.
That person can then present it to the rest of the group and can come out with an advice package for people to have.
Right. Okay. Thank you so much. Okay, so Ifeoma's book is called His Peace in My Storm, 35 Days of Cancer. And Kolia's own is called Scared but Not Scared. Both books are available on Amazon. Please buy their books. Dr. Gbenga, thank you so much again.
You're welcome.
Oh, okay. Kolia said, I would love to collaborate with you guys, doctors. Reach out to them. Kolia, I'm sure Dr. Gbenga and Debisi will mind. I'll send you the details later on. So, folks, see you next week. Thank you so much for joining us.